Welcome everyone to the first part in this webinar series on social audits, organized by the International Budget Partnership, titled Participatory Audit Process Improves Hospitals in Maharashtra. Thanks for joining us today. My name is Rocio Campos. I am Program Officer at the IVP based in Washington, D.C. I'll very quickly introduce our speakers and the mechanics of this webinar. Today, we'll be hearing from Nitin Jadhav, Associate Coordinator at the Civil Society Organization Support for Advocacy and Training to Health Initiative SATHI, and Ravi Dugal, Senior Program Officer at the International Budget Partnership. Nitin and Ravi will introduce what is a participatory audit and planning PAP process, explain how PAP works, and who is involved in the process. They will offer examples of the impact and successes of PAP in the use of public health funds in the state of Maharashtra, India, and explain the necessary conditions for social audits, and particularly for the PAP to succeed. The session will last approximately 1 hour, with 25 minutes for presentations and the remaining time for Q&A. For those not familiar with this webinar software, or for those who recently joined, all participants are on mute, so we don't have too much background noise. You all should be able to follow along on your screen the PowerPoint presentation. After we listen to the presenters, you can either raise your hand by clicking the hand icon or submit a written question via the question box or chat box. If you submit a written question, I'll read it out on your behalf during the Q&A period, noting your name. If you raise your hand when we get to you during the Q&A period, I will unmute you so you can ask your question. Please do submit questions through the chat at any point during the session. We'll be recording this webinar and will post it to the IVP website. There will also be a brief survey at the end of the webinar, which we would be grateful if you could complete. Again, many thanks to Ravi and Nitin and to all of you for joining today. So to introduce this webinar, I invite you to click on the link that appears in your chat box, so you can listen to Soumya Kidambi describing what social audits are. After that, we will pass on the microphone to Nitin. After listening to that brief video, we will now listen to Nitin's presentation on the PIP process in India. We can hear you, Nitin.
Hello, everybody.
Hello. Go ahead, Nitin.
Shall I start?
Yes, go ahead.
Yeah, hello, everybody. Participatory audit and planning process is evolved as a part of budgetary advocacy related work supported by international budget partnership. I am presenting this process on behalf of various stakeholders such as local government elected representative, health providers, and most important grassroots level CSOs who are centrally involved in the uh, participatory audit process, which I will call as a PAP. As you have just saw the clip and listen about the overall concept of about the social audit process, another process called community-based monitoring and planning of health services is being implemented in India since 2007 under National Health Mission. The main objective of CBMP are to increase the accountability of public health system, uh, to increase the people's participation in the health services, and to convince people that they are should avail health services as a right. In CBMP process, the government has collaborated with almost 24 civil society organizations uh, from 14 districts of conduction of various processes such as awareness, formation of monitoring and planning committees at different level, includes various stakeholders such as health functionaries, elected members, CSOs, and active community members. With the help of these committees, monitoring of health services is being done by collecting experiences, feedback of the people about the health services in the form of report card. Based on the analysis of report cards, experiences of mass event called Janasnuai or public hearing was organized at 3 levels, and community does dialogue with the state officials and present denial of health services. Through CBMP process, significant improvements such as out-of-pocket expenditure has been reduced, malpractices, misbehavior of the health functionaries, and most important, there is an increase of delivery of services. The, the essence is the PAC process is evolved based on the concepts of social audit and the mandate and space created by community-based monitoring and planning of health services. So, as a concept, we believe that for monitoring and planning of any scheme, people's participation and involvement in decision making, resolving issues are very important and non-negotiable. Through this PAP process, we try to intervene in flexible local health funds which were given to each health institution for strengthening the health institution and also for the patient's welfare, and to avail these basic facilities for the patients such as drinking water, cleanliness, and food for the inpatient IPD patient. In order to manage these funds, the committee or decision-making body called Health Management Committee, which we can call Health HMC, which constitute of elected members, health officials, and representatives of local CSOs. The PAP process is being implemented in 9 health institutions from 3 remote and tribal districts of Maharashtra. So this is based on the basically health management committee, which is constituted under National Health Mission and which has very different stakeholders. So PAP process is basically the various stakeholders were involved, such as monitoring and planning committees, which is formed under CBMP, elected members, health officials, and these were the key stakeholders for this implementation of PAP. And the main role has been leading was the civil society organization. The objective of PAP was to ensure the decentralized planning of health services, focusing on the active participation of various stakeholders in the decision making. Then to identify the gaps in the expenditure of health management committee, and also to evaluate the functioning of the health man. And the last is the build the capacity building of health management committee members. There are different stages which has been conducted through this participatory audit process. The first stage we can call it as a participatory process, where the PAP process started with understanding of last year's pattern of expenditure based on the information collected and analysis on the basis of major expenditure. And based on this finding, the poster has been developed and shared in a PAP event. PAP event is organized in the premises of health institution, where all stakeholders called health management committee, monitoring and planning committee members, and the district and state level officials were participated and invited for this PAP event. The event starts with the orientation of the given to all the participants about their role and responsibilities. All documents and the financial record related to health management committee funds, such as book of accounts, vouchers, supportive documents, proceedings, were checked and followed by physical availability of purchase items through the monitoring and through the HMC funds. Then the issues emerged from verification of last year financial records and actual availability of purchase of items was discussed between all the participants, and the decisions were taken, were followed up at different level in the health management committee, CBMP public hearings, and monitoring and planning committee meetings. So these are the stages we can call which are useful for implementation of PAP. Then through this process, there are some key findings were found. One, we can call the lack of clarity to the committee members about their role and responsibility, where we can give example. In most of the places, members were not called for the meetings, or the constitution of the committee were not as per guidelines given by the state government. Then the most of the expenditures were done without the prior sanction from the health committees. In the most of the institutions, proceeding books could not show purchase done with the priority sanctions. Then irregularities in the record keeping related to the expenditure of the funds, where we can say that at the time of PAP process, many committee members couldn't know about the furniture purchase, medicine purchases, and the repair of the pipelines, and how much funds were spent through this health management committee funds. The government officials' intervention in more in decision making as compared to the other committees, where we can say that in one health institution there are around thousands of rupees were spent on purchase of equipments in the health institution. Actually, for the purchase of this scale, the quotations have to be sought to be first, and the purchase should be made. So the equipments were purchased in March 2013, and the quotations were invited in the April 2014. So these are the examples we can say that, and key findings where the PAP process has been implemented. Based on these PAP, there are major key successes or impact we can say. Most of the successes were at local level, where the HMC funds were utilized considering the community need. Various positive changes has been observed. For example, the curtains has been purchased through these health management committee funds, but put up on only doctor's cabin, and the doors of other wards like general ward, women ward didn't have any curtains. So this has been changed, and the curtains were put on the other general wards also. The frequency of the meeting and the has been regularized and the increased. In one in one institution, the expenses were made for purchase on repair of TV and recharge of dish TV. However, during physical verification, there was no TV found in the facility. the villagers who were involved in the PAP process were told that they have never seen the TV in the facility. And after it was revealed that the TV was placed in the ward boy's house. So during meeting, these issues were come up and resolved at that level only. At state level, the major two decisions were taken. The state government decided to implement the PAP process on the basis of this pilot phase in entire community-based monitoring area, and presently it would be implemented in around at least 22 CBMP blocks. And the orientation workshop for the stakeholders who are involved in the decision making has been planned in this month only. Uh, uh, in the case of data, we can see the graph which talks about the number of analysis of resolved and unresolved issues at various levels, and you can see that around 54% issues were resolved at local level, whereas very less issues were resolved at state and district level, because the district and state level issues are very complex and it requires more major policy level decisions. And you can say that around 96 issues were raised through the CBM process. And the lessons learned, the role of the civil society organizations is very crucial and important. The multi-stakeholders group, which are very crucial for implementation of this PAP process, because through they have their authority to take decision and take action on raised issues. The dedicated, active community-based actors who are most important part of this PAP process, because they can raise the issues. Involvement of elected members also important. The mandate from the state or higher level officials is very important for the implementation of PAP process, because they give direction to the field level officials, as well as some action, concrete action or some concrete issues resolve mechanism should be placed at higher level, so that it maintains the motivation of various stakeholders. And the constraining factor, we can say that there is a lack of accessibility of information, then the lack of cooperation and the reluctance from the health officials. Most important for the civil society organizations who are centrally involved in the PAP process is developing consensus among the various stakeholders, because there are various stakeholders with the various vested interests. So developing the consensus among the various stakeholders is very important and challenging task for the civil society organization. Maintaining the motivation of the stakeholder again is a very big challenge, and again the difficulty to ensure immediate and concrete action at higher level. Again, it's a constraining factor which can be resolved through the regular and pursuing through the regular follow for resolving the issue. Thank you.
Thank you very much, Nitin. Now we will pass on the microphone to Ravi Dugal, who will react to Nitin's presentation. Go ahead, Ravi, we can hear you.
Hello, everyone. You just heard Nitin talk about the experience of SATHI vis-a-vis participatory audits and planning. And I think what he shared actually, the experience, it takes a step further the traditional social audit process in terms of tracking local budgets, planning and spending. So it adds another dimension to the social audit process. So in that context, I think it's an important experience, and they have used this by kind of weaving into the community-based monitoring process, which SATHI as a nodal agency for the state of Maharashtra has been implementing in collaboration with the government. And as Nitin mentioned, that now this process is being upscaled. The pilots which were done by SATHI of the PAP process are now being upscaled to all the CBMP districts and blocks. So I think that's an important achievement of this process, and we hope that it will the upscaling will also be done effectively. Uh, uh, what also PAP has done is it has helped build budget accountability and participation in the CBMP process. It has helped to make a shift from just monitoring and reporting to a stronger people's participation in both planning at the local level, whether in the local service delivery institutions or even at the block level, uh, as well as budgeting. So I think that's one great addition that PAP has made. And then the challenge is now to make it uh, and take it at a higher level where district level planning or the program implementation planning process also sees this kind of participation. Now, as you all know that India has had a long tryst with social audits, and CSOs have played a very critical role because the whole process of social audits was originally kind of started by one of a well-known civil society organization called MKSS, which has pioneered social audits of public works program. And similarly, now the government has taken it on in a large way uh, uh, as in terms of implementing it across the country, so, for the National Rural Employment Guarantee Program. And as part of that process, what the government has done, it has kind of set up agencies of its own. You heard Soumya Kidambi right in the beginning talking about one such experience in the state of Andhra Pradesh. Now this is being done by many other states. While this is good that the government is integrating social audits within the process, but the risk that we see in this process is there could be co-option in a sense that uh, with the state agencies may just monopolize the whole process, and the civil society voice or the citizen voice may actually get stamped out. So that is one risk that we see. Now, the experience that Nitin described in Maharashtra, I think there are various things that we can learn from this in terms of the conditions or the processes that make participatory audits successful. First, most importantly, is that there must be some existence of a basic democratic environment and participatory spaces in public domains so that people can engage. Without so in societies where democracy is not well established, or especially at the decentralized level of governance, it may be very difficult to engage with processes like these. Second, people need to realize the importance of such space and own them before they can begin to participate. So if there are such spaces available, I think it can only work if citizens actually recognize these spaces and try and own them, because they actually impact their own lives in terms of improvement of service delivery and better governance. Third, and most importantly, I think the message that comes out of this process is, as well as experience not only SATHI but of MKSS and elsewhere in the world, including in Africa, that there's a criticality of the CSO intervention and its intense involvement. Without CSOs getting involved intensively, uh, this kind of participatory audit may not really happen. It may get captured by vested interests like bureaucrats and service providers or local politicians. So I think that's the CSOs act as an important catalyst in this whole process, and their role is very critical and important. Uh, Fourthly, I think uh, is the whole issue of importance of confronting and questioning the local leaders, like elected representatives, and getting them on board to support demand-based planning and planning and budgeting, and in contrast to the supply-based process with which the bureaucrats are much more comfortable. So I think kind of overturning this pyramid is very important, and it is not possible to do this without getting the local elected representatives on board on the side of citizens. And for this, citizens have to question their leaders, hold them responsible. I mean, demand responsibility from them, because this is the oversight role which elected representatives must play to see that service delivery happens in a proper manner. Then there's accountability. Finally, I think participatory audits need to be integrated within public systems. I think that is very important. I mean, the experience of SATHI clearly points to that, wherein this whole participatory audit being linked through CBMP, which is a process which is integrated within the National Health Mission. And once this happens, then advocacy, so that is at one level. And I think globally also, we need to kind of push for such accountability mechanisms, either through GIFT or through the whole SDG process, where there is effort at trying to make participation as an important element to realize the Sustainable Development Goals. And finally, I think there are a couple of challenges that we need to keep in mind. The one major challenge is that participatory audits is to maintain the autonomy of the process from government agencies who will attempt to co-opt that process. So that risk is there. And because especially if you're dealing with service delivery institutions and auditing them, and you want to cooperate with the government and the agencies, because it's a multi-stakeholder process. So maintaining its autonomy is a huge challenge, and it's not easy. I mean, Nitin can talk more about that later on.
Thank you very much, Ravi.
Yeah, and just one more challenge, I think, which I already mentioned actually, is the absence of democratic processes will make it very difficult to engage with these kind of processes. So yeah, so these were some of the issues I wanted to raise. Thanks.
Thank you very, very much, Ravi, for your reactions to Nitin's presentation. Now let's touch base with our audience. There is a comment from the floor from Sebastian. He says, I agree with Ravi that a democratic setting is necessary for citizens' engagement, but this can be hampered by corrupt officials and a docile public. If there are other comments from the floor, I'm happy to read them out loud. Sebastian adds, women are a major stakeholder in the health sector, and there should be conscious plans to get more women and women groups involved in the process of improving service delivery in this sector. If you would like to click on the hand icon, then I'll know that you have a question, and you can I can unmute you so you can ask it directly, or feel free to write on the chat box so we can read your comments. Thank you, Sebastian. If you would like to be unmuted, just raise your hand. Okay, here's a comment from Judith Nakamanya. Hi, Ravi and Nitin. I completely agree with your presentation. I'm wondering how children can be involved in the process of social audits. Has anyone had an experience? Let's try to pick up a few more questions from the floor before Nitin and Ravi have a chance to react. Sebastian, we can hear you now. Go ahead.
Okay. I run a very small NGO in Nigeria, in the Niger Delta in Nigeria. And I have been having difficulties trying to mobilize the local people because of the level of, let's say, docility in issues that pertain to government, because they feel that government maybe has left them out of the decision-making process. But as someone who has been interested in citizens' voice issues, I want to forge ahead, and that's why when I see platforms like this, I immediately log on to them. So I don't know if there is an opportunity where local groups like us can directly benefit more and more from the various initiatives of the International Budget Partnership. Hello?
Yes, Sebastian, thank you very much.
Yeah.
I'm going to read a couple more comments and then we can give Nitin and Ravi the word again. This is, excuse me if I butcher your names. I'm trying my best pronouncing this. Bhaskar Prabhu from Mahiti, Adhikar Manch, Mumbai, which has social audits of municipal corporation works for. By forming social audit local team, they are meeting every month and people in Mumbai can join them. That's for the group in Mumbai. Judith says, Nitin, how are the HMC facilitated? How often are the PAP events held and at what level? And who facilitates the discussions during the PAP events? And then we have another question, a few questions from Albert from IVP. What is the relationship between scale and impact in social audits? That is, do social audits become more effective the more sites they are done in? What has SATHI's experience been in this regard? So we'll take give Nitin a little space to react to these questions. And Ravi, of course, if you have anything to add, please do so. Go ahead, Nitin. You have the floor. We can hear you.
Thank you for joining and asking question. Regarding the first question, it's related to the involvement of children in the social audit. Yeah, we have some kind of experience about that, but not in the context of social audit, but in the context of monitoring. So there are monitoring and planning committees at village level and at institution level in Maharashtra. So we try to involve involve children in the form of member, and they are the member of that committee, so they can raise their issues, like the issues related to the education, issues related to the school, or their health problems, nutrition, especially nutrition. So these issues are raising by them. So the involvement of children is very can be possible, and we have that experience. The second thing, it's Judith, I think, asked the question, how are the health management committees facilitated?
Yes.
So I think and how often. So this is our first time to implement the PAP process at institution level, health institution level. In India, there are different level where the health services are being given. We tried at primary health level, health center level, where the doctor, the nurses, the health center caters at around 20,000 population area. So it's more related to the preventive level services and some kind of curative level services. And the civil society organizations are centrally involved in the facilitation of these discussions in the PAP event, and also facilitated by civil society organizations are very centrally involved in this facilitation. I think Albert has asked about the relationship between scale and the impact of social audits. Do the social audits become more effective? I think if you want to engage involvement of community, they want some activity, or there should be some activity based intervention or involvement of the community. So visiting health institution is a activity which can be encouraged the motivation of the community, as well as the social audit. I can audit the health institution or the funds of health institution. It's a big thing for any stakeholder, and we are giving that confidence. So we can say that the impact of social audit in sharing the power and power equation, or changing the power in that context, it's very important for the community or any citizen who can ask question and who can say that I can do your audit or the audit of funds. So I think in that context, it's very important and it's very impactful, because people can get their feeling of ownership about that, because it's our fund and I have to decide how it can be used. So I think these are the responses. And the second thing is, Sebastian again asked for what level of financial human resources does local group require to start this process. I think most important thing, the multi-stakeholder bodies, which includes various representative from various strata. For example, in India, there is one major which Ravi has talked about, that there is an elected member who have power and elected by the community, who have power to take decision. This, if you want to engage these groups, we have to form a multi-stakeholder body, and that bodies can be functional through the activity, and this can be done at various level. And there we there is very less funds required for travel at some, we can say, for any the PAP process is being implemented in the premises of health institution. So there is no as such fund required for venue or like that. So some kind of refreshment or travel is important for this conduction of PAP process. I think.
Go ahead, Ravi.
Okay, I think Nitin has addressed most of the questions, and I don't know, maybe I was cut off for a while. So whether the issue about women as major stakeholders, I think the committees which are set up, the health management committees, etc., do have women also as part of the process, and there is an effort to try to see that there is adequate gender balance in this process. And about children's participation, yes, I mean, apart from what Nitin said, I think there are a number of organizations working on child rights which have tried to do social audits of issues that impact, or services especially, which impact children directly in different parts of India. So that process has been tried. So there are examples. I think if you do a Google search, you would probably get that. I'm very interested in what Bhaskar Prabhu has mentioned. I'm aware of the organization he belongs to, but I did not know that you were doing social audits, and it will be very interesting. I'm based in Mumbai, and would definitely like to connect to learn from your experiences. And yes, we can expand it to the health sector, and what actually SATHI is doing is, I think, related to that and experience from that. We're also trying to push the government that the CBMP process must also happen in urban areas, so which would cover municipal health services. So I think Bhaskar, you should meet people from SATHI, but I, being in Mumbai, I would definitely like to look at your work also. And the issue that Albert has raised, that if we scale up, yes, I think if the more it happens, the more people also get interested in it, media picks it up, and the issues, that itself kind of creates it's a self-generation process of raising awareness within society, and so people become more active in terms of social audit, participating in those processes. So I think the more we can scale it up, the more effective we can be in terms of demanding accountability.
Thank you, Ravi. I'm just going to read a few comments from Bhaskar. Okay. 1 second. So he says, Mahid, well, we already read that. He was talking about social audits
Of gardens.
of gardens, right? And they already exposed fraud in 4 gardens, which comes to around 56 lakhs, and we expect action to be taken on agencies. In Mumbai, this is the first time that social audit is happening. And he encloses his email. And they would like to extend the social audit to health services, which is a point that Ravi
Yeah, 56 lakhs
addressed.
is 5.6 million rupees.
Okay. Sebastian asks another question. Where access to budget documents are difficult, how do you go about getting the required information for engagement? That's a very good question.
Yeah, responding from the Indian perspective is that in India, it is not as difficult to get budget documents today, even at the local government level. Local governments, yes, in the remote parts, in the backward districts, it probably is a little difficult, but this kind of transparency has increased substantially in the last few years, and a lot of documents are available online. But I know, yes, in many other countries, even getting a national budget document in a reasonable amount of detail is quite difficult. So this is an important challenge, and that's why I had mentioned that democracy is the bottom line in engaging with social audits, and democracy means that there has to be adequate transparency, access to information, and so on.
Hello.
Yes, Nitin.
Yeah, actually, I told earlier there is a big platform of community-based monitoring and planning which is being implemented since 2007. It's around completed around 8 years. So the through community-based monitoring mandate, we can access these kind of data. And Ravi rightly said that we have the mechanism of right to information, which is also very useful to get these kind of data. But it is difficult at local level because they are sharing the power. Data means sharing the power, I think, and there is they show some reluctance because they doesn't want to share the information. So we are getting mandate from state level as well as mandate from right to information. Regarding one question, it's related to the elected members, local elected officials or local elected members. I think we are closely working with the locally elected members because they are they have authority and they have decision-making power in overall participatory audit process or in health management committee. I think they have their vested interest. So we have to give them publicity, or we have to give them some credit so that we can say that you can if you participate in this process, you will get some publicity, or you can understand what are the major what is happening in the health institution. So besides their vested interest, you can mobilize them with by giving them some publicity, or by giving them some we can say some publicity to them, or some position to them, so they can easily uh, participate. As well as they have some issue of there are some issue of corruption which are being done by these PRI members or elected members. So we have to handle this through the community, and we can say that the elected members can be handled through community only.
Thank you, Nitin. There were a few more questions on access to information from our colleagues Axolile in South Africa. Ax, is there anything that you would like to add on access to information, or anything that you would like to share about what you face in South Africa? We could hear you. Okay, he just posted a couple of questions. Access to information is crucial to conducting social audits. How do you conduct a social audit in a case where government is not releasing information? Our presenters dealt with that question, and has there been such cases in India? And if so, how do you deal with that challenge? So I think these questions have been addressed, but Ax, if you want to discuss this further or share your experience in South Africa, please raise your hand and we can give you the word. And there's a few more questions from Mark de la Iglesia. Can you speak more to the lessons learned about the role of local elected officials in SATHI's work, and what role have they played, and why did they act the way they did? What incentives do they face, whether due to impending local elections, pressure from above in their parties, etc.? Any reactions to Mark's
Actually,
questions? Go ahead.
I told about the elected experience of elected officials or elected members
Sí.
about this PAP process. They have powers. So power of decision making. For example, how these funds can be utilized, on what issues these funds decision can be taken. So they have this power, as well as they have power to sanction the funds. They have power to take decision. So their role is very important. And what we have observed that they doesn't know about all these things. They have power. They are the member of this committee, or they are the these all these powers they have. So in order to educate them, in order to orient them, this is a very big and important task which can be done by civil society organizations. And also we have to say them ki if you can work uh, for the people, especially related to health services, there are many chances to elect once again, or you can elect on the basis of this intervention. There are many chances to elect again. So with this we can say intervention, you can say that elected members can be tackled.
Thank you, Nitin. Are there any other questions? There's a few comments on the use of Right to Information Acts
Yeah.
in different contexts in Nigeria. Sebastian says Nigeria has a democracy and has passed the Right to Information Act, but the budget documents is still treated with so much secrecy. And in other contexts, even though information might be accessible, it might be so aggregated that it doesn't allow for proper use of civil society to formulate questionnaires or ask the right questions to formulate social audit processes. So there are still, even with a Right to Information Act, there's still other challenges with the accessibility of information.
About the Nigeria issue, I think yes, you have the Right to Information Act, but government does not still make available budget documents. Probably Nigeria also does not produce adequate budget information. Also, I think that's also a problem with Nigeria. I mean, the kind of detailed standard budget documents that you get in other countries, Nigeria still has to engage. My question here is, I mean, is it possible to kind of take the government to court through public interest litigation, since now you have the Right to Information Act, and to kind of say that why doesn't Nigeria produce standard budget documents and make it available in public domain? I don't know if that's a possibility in Nigeria or no. The use of the public interest litigation route to access this right to information.
Sebastian, would you like to react to that? You can unmute yourself if you want to. Go ahead. You're still muted by yourself, so you need to click on your microphone so we can hear you. Your microphone is on mute, so you need to click on your microphone. Okay, now we can hear you. Go ahead, Sebastian.
Okay. Yes, thanks for that response. It's true. We still have issues around the way our budget documents, are presented, even when they are not available. And the sad thing again is that the Right to Information Act that we have is there, but there is no agency that has been established to handle cases arising from, demands, to right to information. For instance, if my group decides to test the Right to Information Act and we are not, granted audience, the only other alternative we have is to go to court. Whereas there's supposed to be a commission that handles a lot of these issues. Again, in various government agencies, you hardly find an information desk. So testing the Right to Information Act becomes very cumbersome because you have to begin to find out who is the appropriate government official that is responsible for the information that you are looking for. So we still have a lot of these hurdles along, getting information and also, getting accessible budgets here in Nigeria.
Okay.
Thank you, Sebastian.
An example from India, I mean, in terms of how the RTI Act operates, is that if you can't get information on the web or in printed form normally, you can write to the concerned department where a nodal officer is appointed as the person who's responsible to provide information. So that is one thing, and the other is also there's the whole process of redressal in case you don't get the information. So there are certain mechanisms put in place to assure that that the right to information process works in actual practice. So I have not seen the RTI Act of Nigeria, so I'm not familiar with that. But the Indian one is fairly comprehensive and it has been used as a model by many other countries. So it's a fairly comprehensive legislation which kind of creates mechanisms to see that the information access is provided. They also develop certain templates. Every department is supposed to provide this minimum information so that people don't have to apply for it. And because when you apply for information, it costs, because that is something we struggled for, to make information access free, but you have to pay for Xeroxing charges or whatever, which is there in the RTI Act, and that is something we have to live with. But this is what happens in India.
Are there other comments? If you would like me to unmute you, just raise your hand. We have a few minutes left, so if there's any other questions for our presenters, this is a time to write them on the chat box, or just raise your hand so that you can ask them directly. Otherwise, we're going to give Nitin and Ravi space to give us some final remarks. I also wanted to remind you that the materials for this session are available right now on the materials tab, and they will be available also after the training is over. And as you know, this is the first part of a webinar series. So we will soon send out information about when to register for our second part, which will focus on social audits in South Africa. So if there's no other burning questions from the floor, there's a few comments from Bhaskar Prabhu, and okay, there's a few other comments from Axolile and from Karen. So I'm gonna go ahead and read those, and then we'll give space for Nitin and Ravi to respond and to give us some final remarks. Ax from South Africa says, we have similar challenges in South Africa to what Sebastian is talking about. Can a social audit be done and be seen as legitimate if citizens create surveys without government data? And
actually, I would like to respond on this because
okay,
it's
go
a
ahead.
very important question. Without the mandate of government, can we collect the data? Yeah, we can collect the data. We can do social audit. Important thing is community or the people should come together, and we can say that in India we try to uh, do one exercise or one tour for the community where we try to get people and we are visited the health institution just as a like a trip, and through this process we observe that community get oriented what are the services are being provided by health providers. At the same time the community asks question to the health providers. So it's not exactly the social audit, but we can say that community can monitor or community can do social audit on their own. There should not be there is no require any mandate to visit a health institution or any hospital for the citizen. So a group of citizen can visit to the health institution or hospital and check or ask question to the health officials or health functionary as a citizen. So you have that right to visit health institution, and this can be work out, and we try to work out in Maharashtra, and it was very useful for maintaining the motivation and give direct practical uh, capacity building of the community. So I think citizen can create a survey, or you can get feedback from, or during visit we observed that most of the things which are not covered on the basis of community's need. It's mostly on the basis of doctors' needs or doctors' comfort. So the social audit can be done by community without government data.
And there's a comment from Karen Zimek. We have some experience with social audits in Benin, but it was difficult for us to follow up, and the methodology was quite costly and difficult to apply by the local population. As well, it is only a photography of the situation. We accompany the local investment plans. All right. Well, I want to thank you very much for your attention. Now I'm going to give the floor once more to Ravi and Nitin to offer some final remarks. And again, this recording will be available on the IVP website and on YouTube, and you will be receiving a link for that shortly after this session. And I also invite you to complete a brief survey at the end of this webinar so you can let us know how was your experience with us today. So Ravi and Nitin, please go ahead, and we look forward to hearing your final remarks.
Well, I don't have anything more to add, except that, I mean, Bhaskar has raised this issue of the CAG. CAG is the...
Can you speak a little louder, Ravi? You sound a bit far.
Can you hear me?
Yes, go ahead.
Yeah. So Bhaskar raised this issue about the role of the CAG, which is the Supreme Audit Institution of India. And actually, the CAG is very kind of keenly interested in collaborating with civil society organizations in India. The CAG brings out very effective audit reports, and which actually are not engaged with by the oversight institutions like parliaments and parliament committees and legislators. So they want their reports to be made, be discussed in the public domain. So CAG is actually now kind of mooting an idea to do kind of simultaneous social audits in collaboration with civil society organizations. And they've begun a pilot process. And I attended one of them in Madhya Pradesh state, which is in central India, where the audit by the state agency on of the employment program, the rural employment guarantee program, was being done. Simultaneously, the social audit was also happening. So one of IBP's partners is involved in that process. So this is another dimension being added to that, which could be quite interesting, where the actual audit agency of the state also kind of engages with the social audit process. So this was just something I wanted to add. And I'm a little curious about one of the comments made about some countries being threatened by IBP. I'd like to know which those countries are. Anyway, thanks. It's been a great webinar, and we should stay in touch. I mean, whoever wants to is interested in this. And as Roshio said, that there is a second part to this dealing with the experience in South Africa. So yeah, we'll probably meet again soon.
Nitin, your final remarks, please.
I think thank you very much. Yeah. Thank you very much for listening my presentation. And through these presentations, I think we get some motivation and some to do work more. And I think it's a struggle, or it's a power game, because if you want to intervene in the budget or budget related work, I think it's a very struggleful things, and I think it's a power game, and it's a very challenging thing. So sharing these experience and listening from other countries' experience, I think it would be useful to at least to get direction how we can intervene in the budget related work. And I think the social audit can be possible if the community is organized, as well as they have some ownership feeling about the health institution. I think this is a very important point we can keep in mind. And I think we would like to share our experiences, our material, and if please keep in touch with each other, so that we can share our experiences, and we can go ahead with the this challenging area of budget related. And we have a website, SATHI have website, you can visit that website, and so that we can go ahead with this struggle. And once again, thank you very much.
Thank you, everybody. Thank you to Nitin and Ravi for excellent inputs for this session. And I wish everybody an excellent rest of the day. The session is now closed.
Thank you.